heard or read anything so far that leads you to believe the J&J vaccine is truly unsafe?
What you reported is that this vaccine side effect is extremely rare. It's only been reported so far in less than 1 in a million doses. But it is the first signal that we've heard from any of the vaccines in a relatively robust, an extremely robust safety reporting system. I do think that there's plausible reasons to think that this is a real side effect, that it will be substantiated, not just a signal. But if you look at it globally, this is an incredibly safe vaccine, which has now been used in millions and millions and millions of individuals, both in the United States and overseas, with really a tremendous track record of success.
So, Doctor, given that answer, let me ask you, as we've been mentioning, the reports at least mathematically seem rare, at least 6 patients out of 7 million. That doesn't even reach 1%. So why has it caused so much concern?
Well, I think there's a couple of points. And first is, as I mentioned, this is sort of a new signal. Also, it seems to be very similar to what was reported in the United Kingdom as well as Europe after the AstraZeneca vaccine. It's a very unusual type of blood clot associated with low platelets, which itself is very unusual. So that was a signal that something wasn't quite right. But when you look at that 1 in a million number, the vaccine side effect right now has been seen primarily in younger women. And of those 7 million, only about 20% of those have been administered to younger women. We also know that it takes somewhere between, most of the reported cases are around 2 weeks, within 2 weeks of the dose. And so some people out of that 7 million received their vaccine within that time window, which means that we may not actually be done learning about these cases. So we're trying to get a real sense of those numbers.
Well, Dr. Nelson, we know there are a lot of people watching right now who either received the J&J shot or they were scheduled to get one. What is your message to them?
You know, I think the real message is just to take a deep breath, relax, don't lose any sleep. These are exceptionally rare, and the vaccine is doing what it should be doing in terms of protecting individuals against COVID. I think that if there are concerns, it is now something that we know better about how to treat. But if you have any symptoms and you're within that 3-week window after vaccine, you should certainly discuss it with your primary care provider. But the vast majority of people with symptoms will be just fine.
So perhaps this question is not fair, but do you think it's possible the vaccine could be removed from the market?
You know, it's certainly possible. The CDC has essentially 4 options, and one is to remove it from the market, one is to return it to circulation, another is to extend the pause, which I think is probably the direction that it will take, and then the final one would be to allow its use, but with some limitations in terms of age or sex. You have to remember that this vaccine has a lot of advantages. It's only 1 dose. It's really been useful for getting to people who are otherwise hard to bring in for vaccines like those that are homebound, and the cold chain issues, the lack of need for deep freezer storage is tremendously important in the developing world. So I don't see that as a high likelihood, but it is a possibility, particularly if we learn that this is more common.
Dr. Nelson, thank you for your time. We greatly appreciate it.
Thank you.
Continue to bring you all the latest